So this is Sean. Sean is a patient of ours and has been now for maybe a couple of years. Is that right?
I think a little over 2.
2 years. And how were you referred to us?
It was a friend from church, actually, a longtime friend.
And they referred you for what type of health issue were you having?
I was having major back issues, to be total disclosure on this, I injured my back at work probably 30-some years ago, and I've had different types of chiropractic treatments over the years, and I get some relief, but it didn't seem like I really got the correction and the cure that I was looking for, but found that here.
What type of work do you do?
I have actually a roofing and construction company, so I do a lot of walking on steep pitched roofs, which didn't help whenever my back was flaring up about 2.5, 3 years ago before I started to come see you. It was really difficult. I couldn't stand more than maybe 15 minutes at a time. My wife and I would go to the grocery store, and I'd have to, go sit down, or if we were at a restaurant or something, we always try to find a booth, where it was more comfortable for me to sit. So it was really an ongoing condition for years.
What would you say the adjustment was like? How would you describe the type of adjustment that you received?
Well, when you explained it to me, in my mind I understood the theory of it, but being, again, completely transparent, it didn't make sense. I just didn't have a lot of confidence. I was a bit skeptic. But when you explained it, I thought, okay, well, the idea of getting to the root versus dealing with the fruit appeals to me. And when you did the test and you explained to me how it works, that the Atlas is the one that really controls things, I was open to it. And then when you actually took me in there and sat me down on the bench and you gave me the adjustment, it was so different from any adjustment I've ever had in my life. Again, the skepticism was still there somewhat, but my wife had been pleading with me, please go see this man. So it was different, Doc, but it was very effectual.
So what after the first few weeks of care, and I guess over the last couple of years, tell me how you would describe how you're doing now.
Well, when you initially treated me, I was really in a lot of pain. And it was a condition that had been going on for a long time. So if I remember correctly, I was coming in 2 to 3 times a week. But almost immediately, I started getting relief. The pain started subsiding. I'd say probably about 3, 4 weeks into it, I think we found a spot where it had corrected. And you kind of told me that because this was a progressive thing, it's going to kind of go in a reversal. So you may get some pains. And sure enough, right after that visit, I had this pain in my shoulder, and you said it'll last maybe a day or so or two. It lasted a couple days, and then it was gone. And from that point forward, it seemed like that the correction was really starting to hold. And, off and on, I think maybe due to my work situation, I may sometimes still, knock myself out a little bit. But I think for the most part, I've been experiencing health really in a miraculous way. I told my wife, this is like a miracle for me. Again, full disclosure, I've been praying for 30 years for God to help me with this condition. And I give the glory to God, but Doc, He used you.
Awesome. So what would you tell somebody who's watching this video that's never been in our office, that they may be skeptical as well? What would you say to them after you've been under care and have gotten the results that you've had?
Well, I have bragged about you, Doc, and bragged about your clinic, what you do here, to a lot of people. And I said, look, if you have a back issue, you need to see this man. Maybe you've gone through normal chiropractic. I did for 30 years. I got some degree of relief, but I never really got the correction and restored health that I was believing for. So I highly recommend you. I tell people all the time, you need to see Dr. Thompson.
All right. Sean, thank you. Appreciate your time and sharing with everybody.
Thank you, Doc.
Absolutely.